Hello dear patients, today we are going to review the case of ulcer on glans penis. A young man came to us with a relatively dense ulcer in the base of glans penis. You can see it on the picture. Inguinal lymph nodes were slightly enlarged. So the patient first saw reddening on glans penis. Also there was some burning. He went to dermatovenerologic dispensary at the place of living. As a result of that, by a rule of thumb, he was set a diagnosis of candidosis. Clotrimazol cream was prescribed and no analyses, apart from syphilis, HIV and hepatitis, were taken at that moment. He had been using this ointment for 3 weeks and it didn't improve. Moreover, rashes gradually transformed into an ulcer that you see on the picture. After getting tired from using clotrimazole and having increased this problematic surface, he came to our clinic. First of all, he was asked about sexual contacts. Before this redness and burning appeared, his last contact was approximately 2 weeks ago. It was casual with an unknown sexual partner. The condom was used, however it was not used during oral contact. So first of all, analyses were taken for sexually transmitted infections, including from the surface of this ulcer and from inside the canal. As a result of that, herpes genitalis was found, herpes of second type. Blood analyses were taken, immunoglobulin M was positive and immunoglobulin G was negative, which indicates a fresh process of disease. Also, PCR analyses of blood were taken for different types of herpes, however, they were negative. So what does this tell us about? First of all, it tells us that you should never set any diagnosis without at least the simplest analysis. In this case, analyses were not taken, and secondly, you shouldn't persist in using an ointment if diagnosis is unclear, particularly if ointments that are prescribed to you in dermatovenerologic dispensaries without any analysis do not help. Then you shouldn't drag time of coming to a doctor who would finally do such analysis. You shouldn't try doing something on your own, as if you take analysis from urethra, it's not a fact that you would be able to find the second type of herpes. So what was done for this patient? A classic treatment of herpes genitalis was done. This is antiherpetic medications internally, immune medications, etc. This is a case of primary infection by herpes genitalis and the corresponding therapy was done. You can watch a separate video about treatment of herpes genitalis on our channel. If it's necessary to diagnose and treat different rashes, including ulcers in the area of sexual organs, you can consult venerologists and dermatologists of our paid medical center, Dermatovenerologic Dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of any rashes in the area of sexual organs. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.